So what do we do in physio? So a lot of those times with physio, it's basically a lot to do with the rotator cuff strength work, the global strength work, the deconditioned, sort of improving just the whole shoulder in itself in terms of like what we can improve range of movement, the capacity. So simple things like being able to pick a kettle, being able to sort of reach for something. These are simple things you and I take for granted, but patients really struggle with this. Now, manual therapy, now I know there's a lot of physios who've also joined this, and they might be questioning whether manual therapy is any good for frozen shoulders. Every frozen shoulder patient that I've seen, as soon as I put my hand on them and be able to just help them feel better, even for a short amount of time, they buy into the process. And that's what it is there for. It's there to be able to help people feel slightly better, help with the pain relief if there is any effect of it, and then be able to have discussions about how long it's going to take, how we're going to focus on strength work, how we're going to be positive about it, and how we're going to sort of address things. Jason, you have some really interesting patients right now who are anxious, who are uncertain about the future and the treatment. And you found a study that also looked at the psychological impact of this frozen shoulder. Tell me more about it.
For sure. Like I alluded to before, you're not treating the frozen shoulder, you're treating person A or person B who sat in front of you, potentially not slept for a few days. This particular study looks at kind of the quality of life and the impact in which frozen shoulder has. So like Rush said, the common signs and symptoms you look for is difficulty brushing your hair, difficulty putting on bra, something like you said, something so simple that we take for granted. But what they found is that there's certain themes that were categorized by the patient's responses. And it's kind of the pain that's there, which is often very severe, especially in the acute phases. But then also they can't explain it. And also they can't explain where it came from, whether it was, for example, a fall on the shoulder, there's a clear question and answer. But with frozen shoulder, something that's insidious. But then also that increasing level of disability and that frustration with the decreasing levels of range of movement often leads to kind of confusion, anxiety, especially around kind of delays in diagnosis. Like you said, something that we're constantly evolving our knowledge on. And then also uncertainty about future as well, whether it comes to work, hobbies, whether they're overhead sports or whatever, whether it's tennis, badminton, but then also in terms of any cost implications as well about further treatment too. So as healthcare professionals, it's our duty of care to ensure that we tackle each of these, as well as kind of the exercise side of things as well. It's a whole body approach rather than just looking at the shoulder, treating the shoulder.
Yeah, I think it's very important to kind of keep this approach, and not just for healthcare professionals, but also people and themselves. And I think this is one of the things we pride ourselves on. We ask deeper questions. How is this really affecting you? And someone could be like, I can't pick up my grandchild. That to me is a problem that needs to be worked upon. It's very easy to just get focused in, here's your range of movement, you've got 10 degrees more than last week. It's more about the deeper questions like, oh, were you able to do this week? And that's what physios need to sort of, get moving towards.